Today, I'm a customer.
Oh, what an honor. Scotty,
80-year-old Scotty Keith and his wife Lee are about to get some shocking news. The man who no one could ever hope to slow down is in desperate need of a life-saving heart valve procedure.
Breathe in. Hold your breath.
So this is what your normal valve looks like. You can see it's nice and smooth here. With the aortic stenosis, you get all the calcium buildup on top of the valve.
He's meeting doctors at Baylor Hamilton Heart and Vascular Hospital, a pioneer in a breakthrough procedure.
Well, I've been going to my cardiologist now for about 10 years, but about 4 years ago, I became aware of aortic stenosis. Ordinarily, the aortic valve is about the size of a quarter. Mine's down to about this size now.
I really had no idea it was that serious and that critical.
For most of his senior life, Scotty has been a volunteer at Baylor Hamilton Heart and Vascular Hospital, Volunteer of the Year on several occasions. He and Lee chose to give back after Scotty had life-saving bypass surgery here in 1996. Now, the former native New Yorkers, inseparable since their wedding day in 1954, are asking Baylor to help extend his life one more time with a procedure called TAVR, a transaortic valve replacement.
We use the TAVR process when they have risks that make the open heart surgical process too high, like a previous open heart operation, lung disease, vascular disease, things like that. We have a what we call a bioprosthetic valve, which is a pig valve that's wrapped into a small metal cage, and that whole device gets put in a thin tube called a catheter. And that catheter is run up from the patient's leg up into their heart, inside the old valve, and the new valve is expanded inside the old valve to scaffold the old valve out of the way, and you have a brand new functioning valve without cutting out the old valve, but just by placing it inside the old diseased valve.
How is it this morning?
We're going to have a great adventure.
I'm blessed where the technology was able to catch up to me. I knew also because of my volunteering that this spring they were going to make it available for more patients than they had before, as they do with all their trials.
How are you feeling about what you know about what they're going to do?
Well, I've been waiting for it. I've been waiting for it since they started the trials here, I guess 2 years ago.
You know, this is what I have, this is what I have to deal with, and at this point, the only thing that I can do to deal with it is to have this procedure. So there's really not that many alternatives. 50% chance that I wouldn't be seeing my great-grandbabies, you know, a year from now. That's a pretty good incentive.
Right.
We're going in?
They're going to go through the groin, up to the heart, and set my heart aflutter. They put a pacemaker in because they couldn't work on your heart if it was beating because the valve would be moving. So they put you into AFib, it makes the heart flutter, they install the valve, and ta-da, that's it.
It may sound simple now, but when Scotty's procedure was first introduced, Baylor was one of just a few institutions in the United States to offer this clinical trial therapy on the frontier of medicine.
All right, there's a bed to your right, okay? You think you can wiggle over to it?
Oh, I still got the moves.
All right.
Just watch and see.
I have such faith in these doctors. I know how good they are, so I'm okay.
Having opened its doors in 2012, the Center for Valve Disorders has rapidly grown on a national scale. The center sees patients from all over the country, and as the word gets out, will continue to expand.
How's it going?
I'm doing fine. I've got my strength back, and you know, it's. I feel as strong now as I had this morning. Now,
a day after his procedure, Scotty was walking the halls of his floor.
I could tell the afternoon of the procedure the difference. It was that sudden and that clear that all the problems that I had or that I was aware of before that were not there.
Scotty is the perfect candidate for this treatment. if such a designation can be permitted, because the procedure is much less invasive than traditional open heart surgery.
Okay, let's get you out of here.
This procedure is a game changer. It's unbelievable.
6 weeks after his procedure, Scotty Keith was back on the golf course, feeling better than he has in years. Remarkably, his story is far from unique, because Baylor Hamilton Heart and Vascular Hospital is ranked as one of the top heart programs in the United States, even if they can't take credit for lowering golf scores.
For a while there, I didn't know what the results were going to be and where I was going to wind up. So this is, it's like all my prayers and dreams come true.
Can I have a heart valve replacement?